Who needs to be screened for colorectal cancer? I know some of those guidelines have changed over the years.
Yeah, I think people are still thinking about the old guidelines. Oh, when you turn 50. No, it is now age 45. That's the key number, age 45. It comes sooner than you think. But they realized that with the rise in colon and rectal cancer, that it was really important to start screening people earlier. Now, for some people, that 45 might be even earlier. If you have a first-degree family member, a mother, a father, a brother, sister, who got diagnosed with colon cancer, you may need to screen earlier. The general rule of thumb is whatever age that person was diagnosed at, you want to start screening yourself 10 years prior to that. Yeah.
Okay.
So this is a situation where it is really important to know your family history. And if you don't know your family history, perhaps you're adopted or you just don't know that family history, it's not available to you, you just assume kind of the worst case scenario, and you do want to definitely start screening at age 45. Yeah.
And if you do have concerns, what are some of those things that you can bring up to your doctor?
Yeah, so definitely we always sort of like to talk about any change in those bowel habits. I know it's kind of an awkward subject to talk about, but it's super important. So if all of a sudden you're noticing you're constipated, it's hard to have a bowel movement, you're noticing blood in your stool, you're losing your appetite or you're losing weight, these are all things you should talk about when you see your physician and schedule an appointment to discuss. Another thing, if you've all of a sudden developed an anemia, an iron deficiency anemia, and there's no great reason or cause for that, that can be another sign of colon cancer as well. Yeah.
And what are some misconceptions about colorectal cancer?
Yeah, I think some of the misconceptions really are just regarding the colonoscopy, which is the procedure actually that's done to detect colon cancer, is okay, it's super terrible and it's awful and the prep is awful. And these things are true. There is a prep you have to do prior to it. But there's different preps now. Some of them involve less drinking of that awful liquid or that it tastes better. There's even some preps that involve a pill. So you can talk to your physician about what they have, and it might not be quite as bad as you're anticipating. And then for the procedure itself, there is no pain. You are mildly sedated for it, which is really nice. So really, you don't have any memory of the procedure. It's painless, and it's just so important to do.
And so the sooner that you see these signs or symptoms or anything like that, should you bring them to your doctor right away?
Right away.
Right away.
Yeah, I would say right away. Don't wait. It's not worth waiting. Oh, let me see what happens over 3 months, 6 months. Sometimes it can be too late. So as soon as you have something, get in and get it taken care of.
Very good.
Yeah.
Dr. Shaw, thank you so much for joining us.
Yes, thanks for having me.